This podcast has been developed by Drs. Schrager and Sadowski in conjunction with the UW School of Medicine and Public Health Office of Faculty Development. If you are on the CHS or tenure track, you have a requirement of engaging in scholarly activity during your tenure here at the University of Wisconsin School of Medicine and Public Health. Scholarship involves more than performing research, teaching, or clinical work within the walls of the UW hospital and clinics. It also involves sharing your work with those outside your institution. The traditional methods of disseminating your scholarly work are publishing and presenting. There are many venues you can present at or publish in, and this presentation will discuss a few of the many options you have. For more information on approaching your work in a scholarly fashion, please visit the AAMC website under Med-Ed Portal Scholarship Guides. As already mentioned, the mainstays of scholarship involve some form of publishing or presenting your work. In addition to these traditional activities, lecturing as a visiting professor, developing or participating in working groups that are multi-institutional, and working on committees may also count as scholarly activities. For example, you are very interested in mentoring residents. In addition to doing this at the University of Wisconsin School of Medicine and Public Health, you also participate in a regional committee on mentoring residents and write about work-life balance. Your written material is used by the committee at meetings and for distribution to residency programs across the region. Your work has now become available outside the institution and therefore has become scholarly. Some might ask, why be scholarly? Well, because you have something important to say. By educating and sharing information, you can change practice and promote debate, moving us forward in medicine. By networking at meetings and by volunteering on committees, you can work on a cause you're passionate about, while at the same time meeting colleagues who can be your letters of reference and nominate you for awards. And lastly, you want to be scholarly because you want to be promoted. Here at the UW, there is a requirement of scholarship to be promoted if you are on the CHS or tenure tracks. To call your work scholarly, there are standards which need to be met, which involve making your work available to others outside your institution. Having your work peer-reviewed and/or having others reproduce your work are two of the widely accepted standards. So what scholarly things can you present and publish? Well, there are many, and this is just a small sample of the possibilities, including publishing educational material, clinical or research manuals, podcasts, research, surveys, and so on. When thinking of where to publish your work, there are certainly the traditional journals of your specialty and in books, but do not forget about electronic publishing such as on websites and other electronic media such as CDs and DVDs. There is also a AAMC website called Med-Ed Portal where you can get your work published and it is peer-reviewed. What about where to present your work? You can do this locally, such as in departmental or hospital grand rounds, or regionally, nationally, or internationally in your specialty societies. Don't forget about physician assistant, nursing, and technologist societies who are often looking for physicians to speak to their groups. How does one exactly make their work scholarly? This does take some thinking and talking to others who have done it. Basically, it involves taking a clinical question or an underdeveloped area and applying a solution through the process of data gathering and analysis. Publishing and presenting your process of answering your question is how you record your scholarly approach and document it for promotion. Now I will provide two examples of how to make your work scholarly. However, realize the possibilities are endless. Discussing your interests in teaching, research, clinical care, or service with your mentors and those who have gone through the promotion process is extremely helpful as you fashion your career in academic medicine. In this first example, you are a faculty member who believes the faculty in your department do many presentations but are not writing many articles on what they are presenting. Your work will focus on incorporating a relatively easy template for people to use in order to transform their presentations into publications. You will also mentor faculty in the process of writing in their area of interest. Over the next 5 to 10 years, you will focus part of your work time on this task and document your work by local, regional, and national presentations and publications. Locally, you set up a new template for faculty to follow when transforming their presentations into publications. You demonstrate the approach of fashioning a publication from existing presentations to faculty members in one-on-one mentoring sessions. You present grand rounds in family medicine, the subject being publishing your presentations. On a regional level, you are asked to present at a Wisconsin family medicine meeting. You present a talk on career development focusing on how to make your work count more than twice. Presentation to publication. You write an article in the Central Chapter of Family Medicine Journal on making the most of your scholarly work, including how to convert your presentations to publications. On a national level, someone recommends you to speak at a small national conference focused on faculty development. Your subject is transforming your presentations to publications. You present an educational poster at a national meeting on being successful in academics by presenting and publishing your work. Lastly, you publish your template and your experience with mentoring young faculty on converting presentations to publications in MedEd portal on the AAMC website. In the second example, you are a faculty member who would like to educate referring physicians about hereditary cancers. Your goal is to help identify women at risk for BRCA mutations so these high-risk women may be appropriately referred. Your work will focus on increasing the awareness and education on hereditary ovarian cancer. Over the next 10 years, you will focus part of your work time on this task and document your work by local, regional, and national presentations and publications. Locally, you begin a new collaboration between genetics, gynecological oncology, surgery, and medical oncology around the topic of hereditary breast and ovarian cancer. You set up a new multidisciplinary approach to patient referrals. You lecture to residents and fellows on the topic. You present grand rounds in obstetrics and gynecology, the Cancer Center, and in the Family Medicine Department. And you speak to the UW Women's Philanthropy Council on the topic of hereditary breast and ovarian cancer to enhance donations to your research program. Regionally, the UW Health Physicians Liaison Office is always looking for good speakers and new doctors to give lectures to smaller communities. You offer your services and speak to the local communities about ovarian cancer. You also present at the statewide family medicine meeting on the topic of hereditary breast and ovarian cancer. On a national level, you write a series of papers on hereditary breast and ovarian cancer with the genetic counselors and other collaborators you have met. You volunteer to work on a national education project on gynecological oncology topics. Through the contacts you've met, volunteering on the national education project, you get invited to present on hereditary breast and ovarian cancer at national CME conferences. In closing, your academic work should focus on a question you would like to answer or on an underserved area you would like to work to improve. Approaching this in a scholarly fashion includes documenting why you think your question is important or why the area is underserved, how you determine this, and how you work to change it. You then need to document how you disseminated your approach to the solution to people outside your institution. The documentation of your scholarship is the key to your success here at the University of Wisconsin School of Medicine and Public Health. Know all of us have had to go through this process and that pursuing your academic interests in a scholarly way is a learning experience. Remember to ask mentors and those who have gone before you as to how to incorporate your interests in your scholarly work and obtain the recognition necessary to be promoted. Thank you for your attention.